watching WorldviewZ. My name is Bridgette Hunt. Today we're at Massachusetts General Hospital at Haven. It's a domestic violence organization, and today we're with Liz Speakman. She's the director here at Haven. Thank you for allowing us into your office today.
Thank you for coming. I appreciate it.
Well, if we can just start by getting a little background information on Haven. I know the name makes me think of a safe place. Do you know how the name came about for the organization?
Yep, the Haven stands for Hospitals Helping Abuse and Violence End Now. Our founding director, Bonnie Zimmer, started the program in 1997, and she thought the name would be certainly let people know that this is a safe place that people can come to within the hospital. And we hope that that's been the case over the years for many people.
What are some of the services you offer for your clients?
We offer a whole range of services for patients, of MGH employees here, and community members. So really anyone who's experienced abuse in their relationship is welcome to participate in our services. We provide counseling, advocacy, support groups. We do a lot of direct service for clients, and it really depends on what it is that they're looking for. Some people we may meet with once or twice and do some safety planning and help them figure out what their options are. Some people we may meet with on an ongoing basis once a week or every other week as they sort through the difficulties in their relationship and sort of think about the dynamics and sort of understand a little bit better about what may be happening. We also provide a lot of services for the hospital community, so we do a lot of training for providers. We can help with protocol development, so if a department is thinking about integrating screening questions for abuse or safety at home into their practice, we can help them figure out how they might do that. We also provide a lot of consultation for providers, so if a nurse or a physician or a social worker meets with a patient and the patient discloses abuse, we can talk with the provider about how to support the patient in addition to meeting directly with the patient. So we can provide a whole range of services for patients and also providers.
How can someone determine if they need your services?
There's any number of ways. Certainly if someone's exploring their relationship and they're feeling uncomfortable or they're feeling unsafe, or perhaps they feel like their relationship is always stressful, or sometimes there's like an incident of yelling or put downs or criticisms, and then sort of things slow down and seem to be okay for a while. And they may just sort of feel like, what is this all about? I don't really understand what's happening in my relationship. They certainly can call us, and we're happy to talk with them or meet with them and help them sort of think about what may be happening in their relationship. Is this abusive? Is it domestic violence? Or is it an unhealthy relationship? It's very complicated, and I think it's hard for people to sort through. So we can sit with them and help them sort through all of those things.
What's primarily the age range of your clients? Do you help adolescents as well, or is there a wide range of the people that you help?
We certainly have a very wide range in terms of age and many other categories. We do work with adolescents. So our youngest clients have probably been 13 or 14 who are in abusive relationships. And we also see people through the end of life. So patients here at Mass General who maybe are in getting palliative care, and so they're contemplating the end of their life. They may be in their 80s or 90s or really any age, and we can provide services for them as well and support. The adolescent work that we do a lot of that in Revere. The MGH has an adolescent health center, which is available for children, adolescents after school, and they go in for birth control pills or STD testing, and we have an advocate there who meets with all the students who come, all the adolescents, most of them are students, all of them who come in, and she talks with them all about healthy relationships and what they deserve in a relationship, and offers services if they're interested in that. So it's a nice way to intervene, hopefully early on, before things really escalate to a significant dangerous level, and let people know what's available for them. So that's one of the services that we are really excited about.
Do you offer assistance to the abusers in these relationships?
We do not. We offer providers here at MGH help with assessment for who's the abuser, who's the victim. Sometimes there's a lot of complicating factors, so we can help the providers assess, what's happening in the relationship. We do not provide treatment for abusers. There are many programs in Massachusetts and in Boston who provide, it's called better intervention programs, and all of them are certified by Department of Public Health, and they have really, important, I think, guidelines around safety and things like that. So if we're working with someone and we think maybe they are being abusive in their relationship, we'll help get them connected to that resource so that they can really work on changing their behavior. So we make sure that we have good collaborations and connections with those programs.
Is there any current legislation or regulations that are being worked on to help you in your efforts?
There's always different legislation. It's hard to keep up with everything. I just got an email yesterday actually that there's a legislation around supporting rape victims, so around sexual assaults. I'm not sure of the details of that, but there are, always different legislation that's happened. There was a recent law that was passed called the 258E, which provides restraining orders for people who are not in a relationship with someone. So if it's a stalking victim or someone who's been sexually assaulted by a stranger, previously there was no protection for them. And so now there's a civil protection order that took a long time to pass, but is a really great resource now for victims of stalking or sexual assault. So Massachusetts is always, working on making sure that the survivors here are as protected as possible.
Do you have males for your clients? I know people primarily think that women are the survivors or victims in domestic violence, but do you help men as well?
Absolutely. Certainly we know that being a woman is a risk factor for experiencing abuse, sexual assault, or physical assault in your relationship, but men absolutely experience abuse and assaults in their relationships. From what I've seen, same-sex relationships tend to have about the same rates of abuse as heterosexual relationships. It's about 1 in 4. So it's a pretty high statistic. And we do see men, we see folks, transgender folks, we really have a wide range of clients who come to us, and we're happy to provide the services and also help them get connected if they prefer a more specialized program. We're very lucky here in Boston to have Gay Men's Domestic Violence Project, the Network Lared, Fenway Community Health. So there are a lot of really great resources that if someone prefers to get those specialized services, they can. But we're also happy to work with them here in our program, and many people do utilize us.
Through your interventions, are you noticing that a lot of people are able to leave their abusers? Do they end up taking your advice and changing the situations that they're in?
Well, we don't generally advise people to end their relationship. We do know that often the most dangerous time in a survivor's life is when they try to end the relationship. That really, since it's about power and control, one person controlling the other person, when the survivor tries to end the relationship, the abuser is losing that control. And so the abuse often escalates at that point. And so what we talk with our clients about is safety and what's most safe. And sometimes actually going back into the home at that moment is the most safe choice for them. And so we talk with them about how do you do that in the most safe ways possible. So we do a lot of safety planning around making sure that you have your cell phone with you at all times, making sure that you know where your purse is, that you maybe even have a bag packed, so if you needed to leave quickly, you could do that. Perhaps talking to a neighbor, letting a neighbor know what's going on, so if you had to go there in the middle of the night or at some time and you needed support, the neighbor would know what was going on and let you come in and provide support, and maybe even calling the police. So we try to do a lot of safety planning. Sometimes for some people that does mean leaving the relationship and staying with a friend, going to a domestic violence shelter, but sometimes it means going back into the home and planning, doing some longer term planning so that when they do leave, they're able to do it in a way that's as safe and confidential as possible. So many people do end up leaving the relationship. I think it's often not on the timeline that most people would hope for, because it doesn't happen quickly. And but I think making it really be a thoughtful plan and one that's going to work in the long term is often more preferable for our clients than making a decision in the sort of spur of the moment. So I think that our services are beneficial and they do help people feel safer, but sometimes it doesn't always look that way from the outside. We do have a client feedback form that we use with our clients, and I was just looking at our data the other day. About 85% of our clients, after working with an advocate for 3 months or so, say that they have a better feeling of personal safety. So that means for some of them they have ended the relationship, and for some it means that they've figured out safety planning within the home as they're thinking about their long-term plan. So most of our clients do end up feeling more safe.
How do you develop like programming or different, I guess, services that you offer your clients? Do you use that feedback to implement things?
Yep, we do. We take a lot of the feedback that we get directly from our clients. We'll have focus groups sometimes to talk with our clients about the benefits of our services, or if there are any gaps, things that we're not providing that they would like to have us provide. We also have been doing a big outreach with providers. So we did focus groups with providers, and we've done a big provider survey. So we're asking the providers, how are our services going? What are we providing that's useful? What are things that maybe aren't working as well that we can shore up? So we try to get a sense both from the MGH community as well as our clients, what's working, what's not working, and how can we continue to provide the best care as possible.
Do you work directly with law enforcement?
We do. We have a really great relationship here at MGH. We have a phenomenal police and security department, and we work very, very closely with them, and so they do a lot around making sure patients and employees are safe when they're here. They provide a huge range of services, including going to court with patients or employees, and making sure that they feel safe as possible when they're here in the hospital. We also do partner with the local police so that we have relationships with the police departments in the communities we serve. We're here in Boston. We also have advocates in Chelsea at the health center and the Revere health centers. So we have particularly good relationships with the community police departments. And a few of those have domestic violence specialists in the police departments. So we have great relationships with those advocates and make sure that our clients know the police are a great resource. It doesn't always feel that way, but that we can help them get connected so that it can be a useful resource for them to call on when they need it.
How do most of your clients learn about your organization?
Most clients, I think, hear about us from providers. So social workers are the main source of referring providers for us here in the department. Haven's located in the social work department, so we have great relationships with the social workers. Nurses also refer a lot to us, and physicians. So I think mostly people hear about us when they come here as a patient, and they talk about their difficulties in their relationship to their provider, and the provider lets them know about Haven. We can go up and meet with someone if they're inpatient. We can see them on the floor. They can come down and see us. We can schedule an appointment. We also, as we work more in the community and we're part of committees and task forces, the community hears about us. So we do get a lot of referrals from community agencies as well. And we have a website now, which is new. We're very excited. And some of our clients find out about us from the internet. And call us up and, receive services that way.
Why do you think there's a stigma around coming forth if you're in a violent relationship? I know like a lot of people shy away from, domestic violence or, wanting to speak up. Why do you think that is?
I think there's probably a lot of reasons for that. One of the things that I've seen is abusers are very skilled at making the victim feel like it's their fault. Abusers consistently across the board blame the victim. I wouldn't have done this if you hadn't X, Y, and Z. And so there's often a lot of feelings of responsibility, like I caused this, or this is my fault, or I've done something wrong. And so there's a lot of shame and embarrassment there of, sharing it, and maybe worry that this person's going to blame me too. And I think historically that has happened. I think survivors of domestic violence have been blamed for the abuse. And so as our culture and our society shifts towards understanding these dynamics, I think that many people do get a better response and a more understanding, compassionate, non-judgmental response. But I think that that history is very real and prevalent for a lot of people. And you know, there is a stigma around being in an abusive relationship. The common response is, why doesn't she leave? And it's not that easy. And so I think there's a lot of people worry, I'm going to tell someone I'm in this abusive relationship and they're going to say to me, why don't you leave? Because they don't understand. They don't understand the dynamics. They don't understand how difficult it is and how entrenched these things are in someone's life. And so I think there's worry around sharing it and what the response is going to be. And so it's part of the reason we try to do a lot of work with providers around how do you respond when someone discloses to you? How do you make sure that you're being compassionate and non-judgmental, understanding, validating their experience, not telling them what to do, not giving them suggestions or advice, but really understanding they're experts. This person you're talking to, they're the expert. They know what's safe. And so how do you help support them in making whatever decision they make for themselves?
Do you offer peer counseling? Like, are there people that have been, you know, trained or coached or received help from your organization that go on to help others that are in the same situations?
We don't have that. I think that's a great idea. If we were a bigger program, I think that's definitely something that we would put into place. It takes definitely a lot of training and, you know, a lot of capacity for that type of thing. I think that would be phenomenal. Some of the other domestic violence programs that are bigger do have those types of things. We do currently have a former client of ours who has been volunteering and helps out with some projects and some awareness activities that we do. So I think it's something that we're potentially looking towards. But you know, certainly many domestic violence advocates who are in the field are in the field for a reason, and they've had their own personal experience, or they've seen things growing up, or, you know, can empathize with a survivor. And so they may not be a peer counselor in that way, but may be able to sort of bring some of those experiences into their work, which I think is invaluable.
How's Haven funded?
We are funded by the MGH Center for Community Health Improvement. Most hospitals, it's called Community Benefits, and so they fund most of our program. We are located in the social work department, so the social service department here at MGH also supports our program in a lot of different ways, including financially. And we also have a grant from the Mass Office of Victim Assistance. That grant funds one of our advocate positions. So we're very well supported by the MGH here, and so we're able to provide free services for anybody who's interested, and that's a nice benefit, I think.
What is the most rewarding part of your job?
There are so many rewarding parts to my job. I really enjoy working directly with clients, so I'm lucky that I'm able to continue doing the direct work with clients in addition to the program aspects and the administrative aspects of this job. For me, sitting with clients and hearing their stories, I think it's, as we had talked about, it's very difficult for people to talk about these experiences. It's very embarrassing. And so I feel honored when someone shares it with me, because I know that it's not easy and it's not something that they share widely or openly with people. And so when someone feels comfortable enough with me and that they trust me enough to be able to share this probably most embarrassing component of their life with me, it's an honor. And so I feel that just being able to sit with someone in that and hear their story and be there for them and maybe offer them something, you know, some thoughts or education or support, strategies for dealing with the anxiety maybe that they're dealing with, or depression. It's amazing. It's so wonderful. And I'm also blessed to be able to do a lot of trainings in the MGH. And so I'm able to help providers figure out how to also have that approach. So when they're sitting with, it has such a ripple effect. When they're sitting with a patient and the patient discloses to them, perhaps some of the things that I've said is like a bug in their ear, and so they're responding in a way that's really understanding and compassionate, and that's wonderful that, I've been able to impact that in such a really amazing way. So there's a lot of very rewarding parts of my job. I'm very lucky.
So I know you have an event coming up, White Ribbon Day. Can you tell us a little bit about that?
Sure. White Ribbon Day is a statewide event here in Massachusetts on March 3rd. Jane Doe, Inc., which is the Massachusetts Coalition for Domestic Violence and Sexual Assault, puts together this White Ribbon Day event. I think they've done it 3 or 4 years now. And so here at MGH, we have a group called Men Against Abuse. And that group has been meeting for 5 years, and they do a lot of awareness activities throughout the hospital. And so MGH, Men Against Abuse, is supporting the statewide White Ribbon Day. White Ribbon Day is a day for men to stand up and pledge to not commit, condone, or stand silent with men's violence against women. So our group is having a speaker come and talk to the MGH community about positive fathering, and we're going to be going to the White Ribbon Day event that Jane Doe is hosting on March 3rd, which will probably be at the State House. So it's really an opportunity for men to stand up, that this is not a women's issue. This is a human issue that we all are impacted by in many different ways. And so White Ribbon Day is an opportunity for men to participate, because most men are good men. And they want to be able to stand up and say, I don't do this, and I don't think this is okay, and I want to teach our children something different. So I think it's a great opportunity for men to have that, be able to speak that and support that. So.
Well, thank you, Liz, for taking the time out to meet with us. The work that your organization does is tremendous, and we just want to wish you continued success. My name is Bridgette Hunt, and you're watching WorldviewZ. Thank you for taking the time out to watch us.